Culture can be very difficult to define, and as you will see in this film, how people respond to questions about culture suggests that it may contain a wide variety of seemingly separate subjects. People speak of personal and group experience. They draw from history, ancient and recent, of countries of origin, and others they have passed through or adopted to settle in. And what they speak of seems intricately connected with questions of belief and practice. The focus of the film is on a specific area of how culture works, that is, to shape and give meaning to what we might call madness. In Western societies, such as in Britain where this film was made, we tend to speak of mental illness or mental health as though we wish to mark the separateness of this form of distress from those associated with illnesses of the body. But as the book accompanying the film explores, using research and clinical material to show how, these separations of different arenas, the physical from the mental or emotional, the individual self from its relationships with family and group, the normal and abnormal, are not marked in the same ways in all cultural groups and societies. The film relies mainly on interviews with a number of cultural communities in East London, an area with a rich mixture of indigenous, migrant and settler communities that are often spoken of as though they were ethnically distinct. Of the white British and of black and minority ethnic groups, the intention is not to show an exhaustive list of cultural groups, but to discover the ways in which cultural diversity works in the arena of mental health. What do these groups think are the core beliefs that unite them and distinguish them from others? What do they think about family and the relationships between persons within the family, between the family and community, between their community and others? What do they think madness or mental illness is, and what should be done about it? What follows in this film are, of course, very particular conversations, triggered by questions that I have asked those who accepted our invitation to speak to us on these very particular subjects. And what they reveal is the complex interplay between different realms of experience and meaning as people negotiate their lives within multicultural societies. We have also interviewed professionals from voluntary and statutory organisations that address what for convenience we will refer to as the mental health concerns of their communities. And they include religious leaders, healers and academics.